everybody. This is just a quick tutorial on how we are going to be doing the S2 competency assessment virtually. And the PowerPoint that I'm going to show you is specific to that, but this will be how we are going to be doing all of the virtual simulation for the rest of the semester. So what I'm doing right now is I'm sharing my entire screen with you so you can see how the process is going to start from the beginning. So I have a shortcut for Zoom on my desktop. And this is what it looks like when you open that. So what you are going to do is start a new meeting. The students are going to be receiving information on which facilitator they are paired with. And what we are doing is we are sort of doing every other session so that if they run a little bit long or whatever, they start a little bit late, whatever happens, that the student isn't coming into a session while there's already one going with that facilitator. So that sort of keeps them keeps the privacy and keeps them to one facilitator at a time. So what you're going to do is hit new meeting in Zoom. And yes, you want to join with audio. You're also going to start your video. You're going to join with video. So I have a warning that says it can't start video, but that's because I'm doing another screen capturing software at the same time, and there's only one webcam on the computer. So I don't need to invite them. They should be joining me. But if they don't know how to do it or they can't figure it out, you'll have your list of students. You can click invite and type in their name. So I do encourage you to use video if you can, if you have the bandwidth to do so. I think having that face-to-face interaction is helping the students kind of calm their nerves right now a little bit. So you'll have Zoom running, and then what you need to do is share your screen. And when you hit share your screen, you're going to find your competency assessment PowerPoint. So this is the one I'm going to be showing you, number 1, COPD. Now, if you have too many windows open, you're going to have a hard time finding the correct screen that you want to share. It only shows you like 8 different screens. You can go to files, but the easiest thing to do is just have the one up that you want. When you go to the next student, bring the number 2 one up, and so on. So I click on this, I hit share, and that brings me to the PowerPoint. I go down, here's the easiest way, this little button here, I hit this, and it gives me the full PowerPoint. So because I'm doing a screen capture software, I have my little picture here, but the same thing happens in Zoom, where my picture would be here and the student picture is here as well. And then if you're doing a simulation where there's 2 or 3 other students, it stacks the pictures all along the side. So the PowerPoints that we're creating are purposely, everything is toward the left side of the screen, which leaves that right side open so that you can see each of the students. Okay, so this is the opening screen that you'll start with. You can advance to the next one, and I'm just going to move this up out of the way a little bit. These pictures are a little bit bigger than what's in Zoom in the screen capture software. So I have, as the facilitator, all of my videos up here, or all of my buttons, I'm sorry, up here. And then the PowerPoint is here. This you're not going to have because this is part of, again, the screen capture software. So this first or second slide is really just to sort of explain to them what's going to happen with us. I sent the students, I created already a tutorial for the students that just has a couple of slides so they know what to expect. But so just to explain to them that they're going to get their brief, which is the SBAR and the initial orders. They'll have time to look at that and take some notes if they want to. They'll work through their virtual nursing process, ADPI, just like they do for all of their other patients. But to understand that it's virtual and there's going to be a lot of, they have to do a lot of verbalizing of things, but still with demonstration, and I'll show you how that works. And then we'll end with a debrief, just like we do. The way this is going to work for simulation, a little bit less with the competency assessment, but more simulation, is that instead of debriefing all the way at the end, you're kind of taking pauses after each sort of step of the nursing process and doing a little debriefing before going on. So then the last piece that's important for them to know is how to annotate in Zoom. And you all need to know how to do this too, because you're going to control this as well. So up here at the top, you have all of the little control buttons in Zoom. And there's this one that says annotate. When you hit that, it gives you a bunch of different choices here. So one of the things we want the students to be able to do is to draw, so circle things, or we want them to stamp, like if they're putting telemetry leads on, you can stamp. Before you advance the slide, you have to clear this. Otherwise, everything that's been drawn is going to carry on through the entire PowerPoint because it's annotating on the screen itself. It doesn't know that it's a slide. So you go to clear and clear all. Then you need to X out of this to advance to the next slide. So I'm going to advance to the next slide, and this is the S bar. So for the S2 comps, the S bar is the same for all 4 situations. So they start with Jacqueline Smith, who has a history of emphysema, COPD, hypertension, etc. We're going to send you all of these PowerPoints so you have some time to look ahead. We're going to send you the facilitator sheet and the orders as well. And this has all of the, the things like what she says, what's happening to me, how does she advance, and so on. Just like in all the rest of the simulations that we do. The next screen are this is her initial orders. So basic initial orders that they have when they walk into the room, which includes continuous telemetry and O2 sat monitoring. So they need to be able to do that with the patient on monitor. And then we have to go to the room. So the first screen is the room. So again, this is where we want the students to annotate or to verbalize. So I'm going to come into the room, I'm going to wash my hands, and then I'm going to put on gloves. They don't necessarily need to annotate on this one, but it's not a bad idea to get them used to it. So again, I'm going to clear all drawings, X out, and advance to the next screen, which is the initial assessment. So we have a blank monitor because the patient is not on monitor yet. She's not on anything. So, and then they have a front and back assessment. So they need to, again, so put the patient on monitor. So I'm going to put her on telemetry, right? I'm going to do the leads. They're going to listen to lung sounds. So I'm going to mark where I'm listening to lung sounds, right? Listen to heart sounds, listen to bowel sounds. Where am I applying the O2 sat monitor? Where am I taking her temperature, if it's oral, whatever. And then going through the head to toe assessment. And so they should be drawing and verbalizing through this whole process here. So they're doing a complete assessment. Again, I'm going to clear all drawings, close this out, and advance to the next screen. So once they've gone through all of this, then this is the results here. So I have built into here heart and lung sounds, so they need to be able to interpret this. So here, so all you have to do is click on it and hit play. And that's a normal heart sound. And then lung sounds, you can click on it or hover over it and then hit play. And this particular patient, she has wheezes, so they need to be able to interpret that as wheezes. Some of the data that we give them is obviously all of the vital signs are here, so heart rate, stat, respiratory rate, blood pressure. This is her telemetry rhythm, so here they need to interpret that this is a normal sinus rhythm, and her temp is here. Bowel sounds we're giving them, she's got good pulses, there's no edema. And hopefully they've assessed pain. It's in her chest, but it's not chest pain. This patient has some tightness and some wheezing and some tightness is probably the best word for it. So from that, they need to, my heart sound just turned back on. Nope, there we go. Okay, so from that, we're going to take a pause. Oh, I'm going to actually add onto this one, the slide, 2 choices. The nurse is going to either leave the room or she's going to make a call. But they need to start making a plan and thinking about how they can implement that. So are they going to call the provider now, or are they going to start doing things for her now? So after that, we go to, hopefully they've done an SFAR. They've called the provider, and we've decided that she has an exacerbation of COPD. They've got, all the patients have fluid orders, and they all have some kind of IV piggyback order, with specific orders as to how long to infuse it over. She also has, this patient has an albuterol nebulizer. They'll go to the clean utility room, pick up any supplies that they may need. They actually don't need any of these things here. Go to the kitchen if there's anything they need. They don't need anything here. And then oxygen therapy. So a couple of things I want them to be able to do in oxygen therapy, and they may have to go bounce back and forth between screens. You can always go backwards if you need to. Is select what they need, annotate, select what they need, annotate here, and then how much oxygen are they going to be giving? I want them to annotate on the meter so that we know that they're actually giving an appropriate amount of oxygen based on whatever it is that they are administering based on the patient scenario. This is the Pyxis. So again, they may have to go back and forth because here's my albuterol, so then we're going to have to go back and administer that. These are the meds for all 4 of the different patients. She does have orders for heparin already. And then the other ones are based on the different patient situations here. The Medrol is here. This is the med station. The fluids that she needs are either normal saline or D5 half normal. You have primary tubing, secondary tubing, flushes, alcohol pads. And then in the MI scenario, they have to mix the morphine into a mini bag. So there's a mini bag here. This is your Lyris pump station. So again, you may have to go back and forth, go back here, and then come back here. There is no circumstance that they need a B channel. Everything is primary, secondary. But what they'll do, again, this is annotation, is they'll figure out their math, and then you can text in, this is normal saline, and then write the rate and the volume to be infused. And then do the same thing with the secondary. The med station, there are the syringes and needles that they need. And then when we get to the medication administration, there's a body. So if she needs heparin, then I'm going to go ahead and show where I'm giving the heparin. So now hopefully they've gone through, they've implemented everything. Now hopefully they've gone through a reassessment. This, you'll notice, is the same vitals that she had before. So you need to talk about, what are you reassessing here? What would you expect to see? Because we're trying to get that critical thinking. So what would you expect to see now that I've given her this Medrol, I've given her albuterol? Where would you reassess on the patient? And then that takes you to debriefing. And then the slideshow ends, and that's it. So you can have that conversation. It'll take you back to your Zoom screen. Stop sharing. So then you'll have just a video, like it'll be your big head talking here, not just your picture here. And that is it for as far as the logistics of working the slideshow and doing the interaction with the students. I'm going to send you more information, separate information, with what we're looking at for scoring, what we're looking at for sending you the PowerPoint, sending you the orders and the SBAR and all that stuff. So stay tuned. And just so you guys know, we miss your faces. So anytime you need to Zoom or FaceTime or whatever you need, we're here for you. You can email, call any of us. Hopefully we'll see you soon.